Has your doctor ever asked you to undergo a colonoscopy? Colonoscopy is a screening test for colon cancer. The reason is, colon cancer is very common if you are over 50 years old, and is considered one of the most common cancer after lung and breast cancer. My name is Dr. Amir, and welcome back to my YouTube channel. Colon cancer affects both males and females. Most of the time, patients don't have any symptoms, which will make it very difficult to diagnose it in the early stages. This is the reason why it is recommended to undergo a screening colonoscopy for any person at the age 45 to 50 years old. Sometimes we can discover a small polyp or a mass in the colon, which we can remove during the procedure or take a biopsy from it. Most of the time, colon polyps are benign and not cancerous, but it can transform into cancer in few years if it's not removed. So removing it at an early stage will prevent the development of colon cancer. Did you know the former US President Ronald Reagan was diagnosed with colon cancer during routine screening colonoscopy? He was cured from it after having surgery and lived 19 years later and died from another cause. So what are the symptoms? Most of the time, patients don't complain of anything in the early stages. Sometimes there is a slight bleeding from the cancer, so patient might notice some blood from the rectum or on the stool. In other situations, we can find a trace amount of blood during a stool analysis under the microscope. Of course, finding blood in the stool can also be coming from hemorrhoids. So for this reason, it is important to consult your doctor to make the correct diagnosis. Other symptoms for colon cancer are new onset of unexplained bloating, abdominal pain, or weight loss. Also, the presence of any changes in your usual routine bowel habit, for example, a new onset of constipation, or narrow stool, or black color in the stool, can all be signs for colon cancer. One of my patients was feeling tired for a few months. During blood tests, we discovered low hemoglobin and iron in the blood, indicating a new onset of anemia. The reason is the colon cancer was bleeding very slowly over a few months and caused the anemia, and the patient did not notice the bleeding. What can cause colon cancer? Most of the time, it is genetic. That is why it is imperative to screen family members for patients with colon cancer. Also, there are other factors which can cause it as well. For example, eating a lot of red meat and junk food. Also, excess smoking and alcohol, as well as lack of high fiber in the diet by not eating fresh fruits, salads, and leafy vegetables. At the end, don't neglect to consult your doctor if you discovered blood in the stool or any new changes in your bowel habit. Finally, routine screening colonoscopy is very important at the age 50 or at younger age if there is a family history. If the test is normal, you don't have to repeat it again until after a few years, depending on your case and your doctor's advice. The good news, colon cancer is a curable disease if it's discovered early. I hope you enjoyed my topic today. If you do, please like, share, and subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy holidays and a happy new year.